The other thing about
the
other thing about medicine, it's a referral system. Yeah, nobody will fault you for not knowing everything. So if you're at this level, you can always call for a senior to come and review. You're always allowed to call for help.
Okay.
And I think the pass mark issue, that's the minimum. I mean, and I was just saying of the minimum. People get 90s,
but
100s.
other courses, pass mark is 40.
Now pass mark 50, a medicine, by the way, your jokes.
50 is not
sawa.
a joke.
But still there is 50 remaining. As in kuna 50 bado umebakisha. So sawa, pass mark ya 50 ni nzito sana.
Yes.
So doctor mwenye akona 50, mkia, hii ya 50, ndio akina Mugo wa elimu.
Hapana, huyo hakuenda medical school.
Hakuenda.
Hapana.
Ni kujiamini. Wanaingia na imani.
You cannot speak on his behalf.
Yes. One of our leaders, I can't remember who, recently suggested that doctors should be paid based on recoveries. Vile ukipeleka gari yako kwa mechanic, ikikuwa sawa, ndio unalipwa. Wewe kwanza unawaki union. Would you support that?
No, I wouldn't.
Why?
So let's appreciate the first thing that these are professionals. So it's basically in medicine, what you do is you come, you treat the patient, you institute, and there are protocols. You don't do things out of nowhere. Like if we're to do an audit of anything that has gone wrong, there are protocols that one must have followed. Now those protocols, you will not see me looking at them when you're with me, but in my head,
yes,
that's where the stored information is. So I'm supposed to follow protocols and to ensure that by the time anyone comes to cross-check what has happened to a patient, then it is standard. So it is standard whether I'm in Kenya, whether I'm in the US, whether I'm in the UK, it's standard treatment for every single person that you treat. Now, one thing that we cannot guarantee is how your body responds to treatment.
So again, guesswork.
No, it's not
how your
guesswork.
body responds.
He has used the statement protocol, and maybe he's really simplified it. But protocol is actually, for example, in pediatrics, ya watoto, Dr. Kingori,
yes.
Pediatrics. So a child comes like this is the next question. It's almost protocol, but because we've learned it so much over and over, you won't see us referring to it for most time. So ideally, if you come later and question, why did this child pass away, there was a system. Anybody who came ideally followed the same system. You cannot pay based on recovery because it's based on disease level, disease progression, body's response. There are too many
confounding factors.
Yes, that are not fully dependent on.
Sawa. But then my other question would be, sijui mambo ya pediatrics. Si mtoto ni a small human being, si a small adult. Why would you go study differently?
Let me correct. A child is not a small adult because the way, yes, their body is still growing, that's the first thing. The way their body is functioning in terms of their physiology is not the same as me and you.
Me, if you ask me the difference between adult and mtoto, we had meat.
To you, yeah, but to us, that's how I'm telling you. So, so the reality is, Pia, that they're not the same. So for a child, there's a specific level of care and approach to treatment and management of that baby or that child that is very different from the adult. So that's where the difference comes in. And you wouldn't be able to tell that because even when we are seeing that child or the baby, you wouldn't. That's why I keep saying that there's so much information in the brain that no one sees it. So that effort of having all that, being able to quickly now do that. And then there's the other aspect, of course, of care, of talking to the patients. But then it's tough, people bring, we are in a profession where you're seeing people at their most vulnerable. By the time you're coming to the hospital, you're at your most vulnerable position. So actually, we are supposed to be, and we are actually a stepstone of hope. That I've gone to the doctor, and I'm hopeful that I will recover. Whatever I'm feeling in my body, actually, I will recover. So by the time you see us, we give you treatment, and then you start feeling that, actually, I'm actually recovering, I'm feeling strong.
Yes.
And that's the satisfaction that you get out of it also.
Okay, two things. Doctors, you need to clear the air about this. As doctors, one, excuses. Doctors are the number one excuses people use. Ati watu wengine wakulangi mboga alikatazwa na daktari. Watu wengine waogangi maji baridi daktari alikataa. What's the truth in that? First of all, like bodies za watu, of course najua ni different, but how comes the doctor's word is the inaitwaje the ultimate hiyo kabisa.
That's why it's a noble
Juu tu ya 6
profession.
years.
That's why it's an ati juu tu ya 6 years. You know, you actually appreciate when you land on a quack. Is when you'll appreciate the value of going to a professional doctor. And the other thing I keep saying is nobody else, apart from in a relationship setting, nobody else asks you to unbutton your shirt right now. They walk in here and they tell you won't. But to the doctor, you go and tell them, I'm feeling pain. They tell you, let me see. And you just...
Tanasha kuja niambie hivyo sahi. Unbutton your shirt.
But it's very, one of the things is different people respond to different things very differently. It's the same thing, you try and get somebody to quit smoking, and then the doctor tells them. And by the way, no matter how difficult it is, they'll actually quit the habit, the smoking, the alcohol.
But doctors are supposed to give hope. She's brought up a very, very good point. Doctors are supposed to give hope. Kuna doctors, hii ya warning, wanakuambianga, if you don't quit smoking, you'll die in 6 months. Aya, kuna ingine tena ya, ati sasa wewe utaenda tu nyumbani because go bond with your family for the short time umebakisha. Where is the hope in that?
Okay, so I think maybe the most important thing is that, and that's one of the communication skills that we normally are taught, even right from medical school, is that I'll listen to you, I might even send you, and then I'll come up with the diagnosis. And then with that diagnosis, I know your prognosis, which means probably your chances of survival, treatment, based on, again, how
so you know.
Staging, that probably 30%, 20%. So when someone tells you, this is what you call palliative, that this disease where you are at, especially cancer patients sometimes, is that it has progressed too much. Okay. So essentially where you are is the chances of you recovering fully, let's say 40%, 30%. So you now start anticipating that in the next few months or 1 year, you'll actually die out of the disease. Because one thing about medicine is this, life and death is real. You know, there are two treatment outcomes are two. You can recover or you can die, despite being treated. You get? So when we do that is you're supposed to also start preparing your patients for the next outcome. So if the outcome is not recovery, and the outcome is, life or death. So if the outcome is death.
Don't say heaven, life or heaven.
Heaven is our, So depending on that, you sit, you now start, and that's the most tough thing to do as a doctor, by the way. I mean, sitting with you and perhaps your family and telling them, this is bad news, that at this point, spend as much time with your loved one as possible, because as per the way the medicine is and what we are looking at, you perhaps have the next 6 months to 1 year. But you know, we're also not God by the end. I like that the fact that you said heaven. We also don't decide when you die. We can only give that as part of it.
Have you found yourself in that situation? Yeah. Kuambia mtu wewe?
I don't give the time left, but I give the true picture given what we are working with. I think also our culture doesn't allow us to talk about...
To give time?
No, just to talk about death. We don't want to talk about it as a culture very much. But I think it's usually fair when somebody knows that whatever we are dealing with, there's not probably too much time. People should have time to go and, you know, apologize, you know, put their things in order, you know.
Why should they apologize?
No, just to go and, you know, when he said go and make peace with people.
People regret. Like I actually have gone through those scenarios, by the way, out of practice. And I remember what happens is, and from experience, is that I'll sit down with you as a family, tell you this is what we are anticipating. We are doing our best in terms of treatment. But if death does happen, do not be surprised, don't be shocked. It could happen because of where your patient is. And trust me, there's a day I think I was just walking in town.
Yes.
And someone stopped me and said, "Hi, Daktari. I just wanted to thank you for what you did during when we had our father in the hospital." You know, so it gives them peace later once that person has transited to heaven, and they sit back and they remember what happened. So you see, they'll appreciate when you tell them, talk to your relatives. I mean, make peace, because then once that person goes, when they start reflecting on their relationship with that person, they actually thank you for giving them the chance to do that. Because you know, there's nothing as bad as I came to the hospital today, I saw you, like I'll see you later. The next thing the call comes is your person is normal. So you never
That's
had that
sad, yes.
chance. So that's the beauty of quickly preparing relatives when the situation is not really good.
But that's only applicable
Yes.
if the illness is a bit long term.
Yeah.
Sometimes you can get quick, sudden illness and actually
Yeah.
die really fast.
And then